at the North American Menopause Society, and we are at the poster session now, and I am speaking with
Christina Escobar
and
Jenna Friedenthal.
Nice to meet you both. You have an interesting poster. Tell me about it.
Thank you. Yes, so this is our study. It's taking a look at cervical cancer as a patient population in an urban at-risk academic center, and that's our hospital at Bellevue in New York City. And we basically did a descriptive study looking at the characteristics, the risk factors, and the clinical course of our patients.
You want to know who's at risk for HPV.
Correct.
Human papillomavirus, because those women are at more risk for cervical cancer.
Exactly.
Super. Now, what did you find?
So we found primarily three things that are very interesting. The first thing that we found is that most of our patients are actually here from the United States as their country of origin. When we originally started the study, we felt that some of our patients would be from other countries and coming in here for screening and healthcare, and it was actually the United States where most of our patients were from.
Okay.
We also found that most of our patients actually had insurance, so about 71% of our patients were insured. And the most important finding, I think, from our poster is this graph right here.
Okay.
And it shows that age at diagnosis, that we had 16% of patients that were 65 years or older, and these patients actually wouldn't have been screened per the ASCCP guidelines.
So, in essence, Jenna, come over here.
Sure.
So, the finding that the majority of these women, there are so many women that were 38 to 65. What does that mean in real terms?
You know, I think beyond what's more important even than the 38 to 65 age range is our findings for 65 and greater. You know, according to our current guidelines, these women wouldn't have even received pap smears. And we can see clearly that there's a significant number of patients that are 65 and older that are suffering from invasive cervical cancer that otherwise wouldn't have been diagnosed. And I think that's important, and we have to kind of broaden our expectations of what the quote elderly population is doing in terms of sexual activity and how we should be screening them.
So if I can summarize real quickly, you found that many women age 65 and or age 65 were at risk for human papillomavirus, putting them at risk for cervical cancer. They had cervical cancer, but they wouldn't even get a pap smear because they're 65 according to the standard guidelines. So we have to realize that women in menopause should be still getting their pap smear anyway.
Correct.
Well, thank you. That's very interesting. Thank you very much.